Today we will learn small intestine meridian of Han Taiyang. The small intestine is located in the abdomen between the stomach and the large intestine. It has the exterior-interior relationship with the heart. The main functions of the small intestine are reception, digestion, and separation of clear from turbid. First, receives and digests the chyme. The small intestine receives the chyme from the stomach and retains it for a certain period of time to further digestion. Dysfunction of the small intestine will lead to indigestion, abdominal distension and pain, diarrhea, and loose stool. Second, separates the clear from the turbid. The clear refers to food nutrients, and the turbid refers to the waste of the food. After further digestion of the chyme, the small intestine separates the food essence from the waste and absorbs the essence and transmits the waste to the large intestine. Because the small intestine absorbs a great amount of water, there is a saying, the small intestine dominates thick fluid. If the small intestine is abnormal in separating the clear from the turbid, the stool will be sloppy and the urine will become scanty, or it may lead to profuse urination and constipation. Third, the heart and the small intestine. The external and internal relationship between the heart and the small intestine is formed by the connection between their meridians. Pathologically, if heart fire gets hyperactive, the heat may be transported into the small intestine through the meridian, which will lead to the dysfunction of the small intestine with scanty urine, deep yellow urine, or pain and a burning sensation during urination. The heat in the small intestine may ascend along the meridian to affect the heart, leading to symptoms such as mental restlessness, redness, and ulceration of the tongue. 阴阳十一脉九经 Cauterization canon of the 11 yin and yang meridians is a silk manuscript discovered from Ma Wangdui tomb. In it, the small intestine meridian of Han Taiyang is called shoulder meridian, rather than the Han Taiyang meridian, since it mainly reached the shoulder region and men used to treat shoulder problems. All indications are related to the body surface distribution of the main cause of the meridian, and there is no description of visceral-related diseases. The small intestine meridian of Han Taiyang includes one main cause and two branches. Like the other Han-Yang meridians, the direction of it is from hand to head. Main cause. The small intestine meridian starts from the ulnar side of the tip of the little finger. Following the ulnar side of the dorsum of the hand, it reaches the wrist, where it emerges from the head of ulnar. From there, it ascends along the posterior aspect of the forearm, passes between the olecranon of the ulnar and the medial epicondyle of the humerus, and runs along the posterior border of the lateral aspect of the upper arm to the shoulder joint. Circling around the scapular region, it meets 大椎 Du14 on the superior aspect of the shoulder. Then, turning downward to the supraclavicular fossa, it connects with the heart. From there, it descends along the esophagus, passes through the diaphragm, reaches the stomach, and finally enters the small intestine, its paternal organ. Branch 1. The branch from the supraclavicular fossa ascends to the neck and further to the cheek. Via the outer canthus, it enters the ear. Branch 2. The branch from the cheek ascends to the infraorbital region, goes to the lateral aspect of the nose, and joins the foot Taiyang bladder meridian at the inner canthus. Let's summarize. What are the related organs and tissues of this meridian? Heart, stomach, small intestine, eyes, ears, and nose. And this is the only meridian that goes to both the inner and outer catheters of the eyes. Collateral vessel. The Han Taiyang collateral vessel separates at small intestine 7, 支正, 5 cun above the posterior lateral aspect of the wrist, and moves internally to connect with the Han Shaoyin heart meridian. A branch ascends and crosses the elbow. At large intestine 15, 肩盂, it connects to the shoulder joint. Disorders of the Han Taiyang system. First, meridian disorders. Disorderly meridian qi produces throat pain, swelling at the mandible, difficulty in turning the head, wrenching shoulder pain, and pain in the upper limb. The meridian is used to treat ear humor disorders. The ear is just similar to Jing fluid of the Han Yangming large intestine disorders. The humor is relatively thick fluid. It is a kind of ancestral liquid, stays in the joints to supplement the brain marrow and moisten the body skin. The disorders include deafness, blurred vision, and swelling of the cheek, as well as pain at the posterior lateral aspect of the neck, mandible, shoulder, upper arm, elbow, and forearm. Second, collateral vessel disorders. In collateral vessel disorders, the excess pattern presents as flexidity of the joints and atrophy and immobility of the elbow joint. The deficiency pattern presents as fleshy excrescences. To treat, use the lower connecting point, small intestine 7, 支正. Summary of small intestine system disorders. Meridian disorders. Inflammation and paralysis, especially of the shoulder. Disorders of the neck and back, stiff neck, cervical spondylosis. Disorders of the ear, deafness, tinnitus, otitis media. Disorders of the face and cheek, paralysis, pain. Disorders of the lower back, acute and chronic low back pain. So much for today.